Hello and welcome to another ultrasound case of the month. My name's Tristan Withers and today we're going to be talking about lung ultrasound used to diagnose pneumothorax. So this is our third case. We had a 22-year-old lady come to the emergency department who was generally fit and well and presented with a sudden onset episode of chest pain while she was cooking. She didn't have any risk factors for PE or DVT. She looked well, had a basically normal examination. She had a chest x-ray that showed this possible left pneumothorax, but it was possible that it was also just a skin fold, and I'll show you the x-ray in a minute. So our main questions were, is it a PE? We thought not, because she had a well score of 0 and was PERC negative using the PE rule out criteria. Could it just be musculoskeletal pain, or could it be a spontaneous pneumothorax? This was the x-ray that I was talking about. So the main thing to notice in an otherwise normal looking x-ray is this line that you can see kind of running down on the left lung field. And there was a bit of debate about whether there might have actually been some lung markings the other side of it, but the radiologist who first looked at it was at least uncertain whether this was a pneumothorax or not. So this was the lung ultrasound, and the thing to note is that we're in longitudinal using the curvilinear probe. So that means the head of the patient is up towards the left of the image and the feet of the patient are down towards the right. We can see two rib shadows here, these black things with the white bits at the front, the ribs, and then we can see the pleura, which is this bright white line, and you can also see some A lines in the lung, which is like a normal reverberation artifact from the pleura. So the main thing to see is that she has normal lung sliding, and what we mean by that is she has the characteristics sign, which people describe as ants marching on a log, which is just this white line has a little bit of movement. You can see some kind of twinkling movement going from left to right and back as the patient breathes. In M mode, which looks at movement over time along a particular line, we can see the classic seashore sign. So we've got the waves here and the sand here, and this is another feature of normal lung, shows that there's normal movement at the pleura. So these ultrasound images basically demonstrate that there's no pneumothorax visible on the lung ultrasound. On the right, we have the same thing, so head's towards the left of the image, feet are towards the right. We've got the two rib shadows here, and we can see the pleura. This one on the right, instead of a rib, it's a costal cartilage, because you can just see the pleura through the blackness, whereas the one on the left you can see is definite rib, because you can't see anything behind it. And again, we can see this ants marching on a log, nice movement, left and right and left as the patient breathes, so no pneumothorax on the right. And given the patient's upright, the apices where we're looking at the moment would be where you'd expect to see a pneumothorax if there was one, so we can be pretty confident that there isn't one. Again, the M mode on the right was pretty normal. So just to tell you what a pneumothorax looks like, and this is an image from Life in the Fast Lane, but you can see here that on the right of the image there's no lung sliding at all, so that pleura is completely static, and then on the left we can see a bit of moving pleura that's coming in and out, and this is called the lung point. This marks the edge of the pneumothorax. So the pneumothorax is on the right hand side of the image and the normal lung is over on the left. So the conclusion was that this patient doesn't have a pneumothorax. They were discharged home, they didn't need any further imaging, and that saved the patient a couple of hours in the emergency department. So that's the end of the case. Thank you for listening. I hope you learned a little bit about lung ultrasound when looking for pneumothorax. It's a very sensitive test, and it's a very good way of helping to diagnose or rule out pneumothorax, either in trauma or in other situations. And I hope to see you at the next video.